Vaccines should work against Omicron variant, WHO says. Lab tests in South Africa suggest Omicron could evade the Pfizer jab. Existing vaccines should still protect people who contract the Omicron variant from severe COVID cases, a World Health Organization (WHO) official says. It comes as the first lab tests of the new variant in South Africa suggest it can partially evade the Pfizer jab. Researchers say there was a very large drop in how well the vaccine's antibodies neutralized the new strain. But the WHO's Drive Mike Ryan said there was no sign Omicron would be better at evading vaccines than other variants. "We have highly effective vaccines that have proved effective against all the variants so far in terms of severe disease and hospitalisation, and there's no reason to expect that it wouldn't be so for Omicron," Dr. Ryan, the WHO's emergencies director, told AFP news agency. He said initial data suggested Omicron did not make people sicker than the Delta and other strains. "If anything, the direction is towards less severity," he said. The new South African study, which has not yet been peer-reviewed, found the Pfizer-BioNTech vaccine may be up to 40 times less effective against Omicron than the original COVID strain. But Omicron's ability to escape vaccine antibodies is incomplete, said Prof. Alex Seigel, a virologist at the Africa Health Research Institute, who led the research. He said the results, based on blood tests from 12 people, were better than I expected of Omicron. Prof. Seigel said vaccination, combined with previous infection, could still neutralize against the variant. That suggests boosters may bring a significant benefit. Scientists believe previous infection, followed by vaccination or a booster, is likely to increase the neutralization level and will probably protect people against severe disease. More data on how well the Pfizer jab works against Omicron is expected to be released in the coming days. There is no significant data yet on how the Moderna, Johnson & Johnson and other jabs hold up against the new variant. Omicron is the most heavily mutated version of coronavirus found so far. It was first identified in South Africa, where there is now a surge in the number of people catching COVID multiple times. UK Prime Minister Boris Johnson's spokesman said early signs suggested Omicron could be more transmissible than the current Delta strain. But Omicron's ability to cause severe disease is not yet clear. Dr. Anthony Fauci, the top U.S. infectious diseases expert, said early evidence suggests Omicron could be more transmissible but less severe. There have been more than 267 million cases and more than 5 million deaths around the globe since the pandemic started in 2020, according to data from Johns Hopkins University. The amount seen in this small study is in the ballpark of what scientists were expecting given the substantial mutations that Omicron has compared with original COVID that the vaccines were designed to fight. What these early lab results still can't tell us is what it truly means in terms of how well existing vaccines work in protecting people around the globe. Neutralizing antibodies, which latch onto the virus to stop it infecting our cells, are just one part of the immune response to COVID. Jabs, or past infection, also trigger T cells that help protect. Vaccines should work against Omicron variant, WHO says.